What is going on, y'all? Psych Perspectives, giofvcks here. And in this video, I'm actually applying for healthcare. So that's why I wanted to make this video. Healthcare.gov. I am on healthcare.gov, the website. If you don't know, right now, February 15th, 2021, the marketplace has opened up again. And they open up the marketplace again through healthcare.gov, which is the Affordable Care Act, which is Obamacare. However you want to call it, Affordable Care Act, ACA, Obamacare. The point is the marketplace is open. They are allowing people to sign up through a special portal because, as you know, a lot of people have lost their jobs, thus lost their health care. A lot of people had lost their health care anyways, and then a lot of jobs, companies, businesses, institutions, organizations already do not offer health care insurance as it is. So healthcare.gov is open. So when you first get on here, it says find healthcare coverage now, enroll today, get covered for 2021. You will put in your state and your email address, and then you will click start here. And then it'll ask you if you want to enter in your mobile cell phone number so you can get text messages and updates and alerts. And you'll put that information in along with your zip code, where you live, and click continue. Next step, signing up. You're going to create an account. So you will put in your state where you live in, the state you live in, your name, your last name. And I'm doing this video because I want to do my part in sharing information and helping other people get linked into healthcare coverage and other resources that can greatly help you, your loved ones, your friends, your community members. So you're going to put in your state, your name, your first name, your last name, your email address, and you're going to be asked to create a password because you're going to be making an account through the healthcare.gov market exchange. So that's what I'm doing right now. And they'll ask you like security questions. Say if you get locked out of your account, you have to pick a few different questions. All right, then you gotta pick up to 3 security questions. That's what I'm doing now. All right, I understand. Create account. So you're gonna create your account. Once that's all in. Also, I'm eating me some oatmeal, really good source for fiber for people who need to get fiber in their diets. Get some of this. All right. Once you create your account, they're going to immediately send you an email. All right. They're going to immediately send you an email with your other, so you can confirm that you have signed up, because you know how it is. Everything is a security check nowadays. And you probably hear Mercy in the back. I just gave him a bone, so he's going through it. Tearing that boy up. Oh, I'm gonna have to, hold on, y'all. So now that we're back, once you have verified your email, and it'll take you back to healthcare.gov, your first email, like your username will be your email and then the password that you had already created. So it says you'll need to complete a 2021 application, view your eligibility results, and get coverage. If you qualify for a special enrollment period, which is what they're doing right now, you can pick a plan and enroll. You may need to submit documents, check your eligibility results for actions and deadlines. If you are eligible for coverage through Medicaid or the Children's Health Insurance Program, CHIP, your eligibility results will give you more information. So those of you who have children, you may be eligible for the Children's Health Insurance Program. Those of us that recently lost our jobs and lost our health care and we don't have a source of income, we are more than likely going to be eligible for Medicaid. So you'll be able to get into these. And depending on your state, a lot of this, like, so there's the federal government and then it's also state government. I'm in the state of Michigan. Our state voted to expand Medicaid and Medicare coverage back under our previous governor, Rick Snyder, who also poisoned the state. And let's just be honest, the city of Flint is still suffering from water crisis going on 7 years later because of Rick Snyder and his shitty ass administration. But one good thing that he did do, which he only did because he poisoned an entire city of people, is he expanded Medicare and Medicaid coverage through the Affordable Care Act. So a lot of us are, in the state of Michigan anyways, are able to get assistance. So you're going to put in your state again. I feel like some of these questions are extremely redundant. You shouldn't be asking us the same question over and over again, and this could be a little more intuitive. But yes, so you put in your state and then you click Start My Application. You're going to put in, they ask you the same stuff. I feel like, again, the website should be more intuitive. Okay, you put your phone number in again. You let them know if it's your home, cell, or work. You put in your date of birth, your street address, you know, basics. And again, I'm just showing this information to potentially help other people sign up for care. You put in your social security number. Continue. Then it's going to ask you, please select the county for the address that you live in. So like you put your county in, please select the city that you live in. This also doesn't make any sense because they literally ask you what, again, the website could be a little more intuitive. I'm just going to call it for what it is. Okay, because then they ask you those additional questions to verify your identity. So it says, your identity has been verified. You now can fill out application for health coverage through the marketplace. Important marketplace emails. If the marketplace has your email address, we'll automatically send you important information, updates, and reminders about marketplace enrollment. You can opt out of these communications at any time. To do this, click on the unsubscribe link in the footer of any marketplace email. Privacy and the use of your information. We'll keep your information private as required by law. Your answers on this form will only be used to determine eligibility for health coverage or help paying for coverage. We'll check your answers using the information in our database and databases and the databases of other federal agencies. If the information doesn't match, we may ask you to send us proof. We won't ask any questions about your medical history. Household members who don't want coverage won't be asked questions about citizenship or immigration statuses. As part of the application process, we may need to retrieve your information from the Internal Revenue Services, IRS, so like tax information, Social Security, the Department of Homeland Security, DHS, and or a consumer reporting agency. We need this information to check your eligibility for coverage and help paying for coverage if you want it and to give you the best services possible. We may also check your information at a later time to make sure your information is up to date. We'll notify you if we find something has changed. So I agree and I understand, and take me to the application. Are you single or married? Single. How many tax dependents, like your children, will you claim on your 2021 taxes? Include all your dependents on your 2021 tax return, even those not applying for coverage. I'm not claiming anybody, it's just me. How much income will you make this year? Optional. Again, they have it, you can mark $54,000 or less, or more than $54,000. You may be eligible to get help paying for coverage based on your estimated income. Do you want to see if you qualify? Yes, clearly. Continue. Because again, those of us that just lost our jobs, technically, we don't have a job. Technically, we don't have any income. Technically, right? Now, if you were approved for if you were approved for unemployment, that is a source of income, but that is not a income technically because it's unemployment. That's not, you get where I'm going with this. So, do you need coverage for yourself? Yes. So you got your first name, your middle name, which is optional, your last name, your date of birth. I really feel like they need to update this because it is rather transphobic. I'm just going to call it for what it is. You need to have sex assigned at birth. And then also when you put sex, there needs to be a space for intersex because people are assigned intersex at birth. And we don't even have a place to identify ourselves. Again, this is why we have to fight constantly for our own freaking rights because we're not even being identified properly. All right. They also have it where like you put your home address and there is a box that for you to put, I don't have a home address. So say if someone is homeless or in between housing, they can select, I don't have a home address. And I think that is nice that they do offer that. All right. And then your home address, the U.S. Postal Service, USPS, return different information for your address because they will prefer you to put the one that USPS has because it's a more accurate. Is this also your mailing address? Yes. Boom. Contact. So I have my email address, my cell phone number, and like what phone type. Boom. Save and continue. And they ask you what is your preferred language. Mine's is English. Save and continue. Contact preferences. How would you like to get notices about your application? This could be via email or text when there's a new notice in my marketplace account. Yes, email or text. And how should we let you know when there's a notice? You can email me and you can text me. And boom. Is a professional helping you complete your application? No. And add a person who needs coverage. I'm just going to say save and continue. If you need to add additional people that's in your household, you can do that. Other household members. In the next sections, we may ask about people in the household who don't need coverage. Why do I need to enter information about people who don't need coverage? We can best determine which savings and programs the household is eligible for when you tell us about everyone we ask about, even the people who don't need coverage. Okay, what information will I enter? We may ask people who don't need coverage but who are married to, will file taxes with, or live with someone who needs coverage. For these people, you'll enter birth dates and social security numbers to confirm who's in the household. You'll also enter income and employment. See, this, for me, I'm single, but for the other person, we're not. We're just roommates. So I wouldn't have all this social security information and stuff. So I wouldn't be able to do that. Will Giovanni file a 2021? Yes. No. New. They ask you, will you claim any dependents? And then they ask, will someone else claim me as a dependent? So for those of you who are younger and have parents that are still trying to claim you, you need to, especially if they're not taking care of you and not really helping you with life, you need to tell them to stop claiming you. Because why should they be getting funds for you when they're not helping you? You're clearly not a dependent in that situation. So this is why we need, especially in the Black community, this is a conversation that needs to be had. Because there's a lot of Black parents who will sit up and claim their kids. They're 22, 23, 24 years old, still claiming their children, yet they don't do shit for their children. They don't help them with anything. So why are you claiming them as a dependent? I'm just putting it for what it is. Parents and caretakers, relatives. Is Giovanni the main caretaker of a child? No, I don't have any kids, thank the Lord. Do any of these situations apply to any household members? None of these apply. No, they ask you if you're Hispanic, Latino, or Spanish. Then they ask you what your race is. You select what's apply. You put in your social security number, which also doesn't make sense why you keep asking. Again, these websites need to be more intuitive. You've already asked us this information. Why do we need to continue to put it back in? Oh my God. Does this name below match the name on the card? Yes. Continue. Are you a U.S. citizen or a U.S. national? Yes. Continue. Disabilities and help with activities. Do any of these people have a special healthcare need, physical disability, or mental health conditions that limits their ability to work, attend school, or take care of their daily needs? And then they say, do any of these people need help with their daily activities, like dressing, or using the bathroom, or live in a medical facility or nursing home? Was Giovanni found not eligible for Michigan Department of Health by, no, because I never applied for it because I didn't need to. Again, they opened this because people lost their jobs, thus lost their health insurance. Did Giovanni have Michigan Department of Health and Human Services and Medicaid, or Michigan My Child, which is the CHIP program, the Children's Health Care Insurance Program, that recently ended or will end soon because they no longer... Will any of the people have income this month? This is deep. So in this question, yes, you'll have income this month. Like for example, if you were eligible and approved for for unemployment insurance, for unemployment, that is technically a source of income, but because it's unemployment, it's not really a true income, if you get where I'm going with this. Did any of these people pay student loan interest, alimony, or educator expenses, or contribute to an IRA in 2021? So you would click yes or no, or click the little box if you did. Okay, now we're going to talk about your income. So you can enter amounts now that update Giovanni's income later in the year if Giovanni's situations change. If Giovanni has more than one source of income, you'll be able to enter more later. If Giovanni gets a COVID-19 stimulus check, you will not enter that because that's technically not income. Select a type of income that me, Giovanni, or you currently get. So you select options. So here it goes. You have jobs, self-employment, unemployment. If you select, and I'm going to read this, enter any unemployment compensation this person is currently getting, whether it's a form of a government office, employer, or union, or federal pandemic unemployment compensation as a result of the COVID-19 emergency. Okay? So you would enter what are you're entering in that, okay? Okay, enter the amount. If you're not sure, make best. So I'm getting back at it. Sorry, I keep having to cut it off because you gotta have. So I put in the accurate, exactly how much I get every week from unemployment. So once I put in that income, Review your application. Make sure that your mailing information is correct, your email address, your phone numbers, your preferred written language, preferred spoken language, your preferred method of getting notice. For me, is text messages and emails. Review your household. You know, you want to make sure your name, date of birth, sex, even though that's not really accurate. In many cases, again, very transphobic. I'm just going to call it for what it is. We have to improve our systems. Marital, tax filing status, your tax dependents, if you're Hispanic, Latino, or Spanish, your race, your social security, U.S. citizen or U.S. national, if you're pregnant status, if you are American Indian or Alaska Native, if you were incarcerated, what is your income? I put in unemployment, state of Michigan, and how much I get every week. Your net income totals are not necessarily accurate because, like, I am not making $2,457.97 from unemployment. If that was the case, like, seriously, we wouldn't even need to do this. We could pay for our own health insurance if that was the case. And then, they give you an expected yearly income, which, again, how do you know how much money you're going to make in 2021 when the year just started and you lost your job 3 weeks ago? So again, these are not accurate, but these are expected. They have to have some type of estimation so they can kind of gauge what you're eligible for. So read and agree to these statements, okay? So to make it easier to determine my eligibility for help paying for health coverage in future years, I agree to follow the marketplace to use income data, including information from tax returns for the next 5 years. The marketplace will send me a notice and let me make any changes, and I can opt out at any time. I agree. If anyone on this application enrolls in Medicaid, I'm giving the Medicaid agency the right to pursue and get any money from other health insurance, legal settlements, or other third parties. I'm also giving the Medicaid agency rights to pursue and get medical support from a spouse or parent. I agree to the statement. I know I must tell the program I'll be enrolled in if information I listed on this application changes. I know I can make changes in my Marketplace account by calling the Marketplace call center, which I'm gonna, hold on real quick. You can call the call center, which is 1-800-318-2596. And they also have another number, 1-855-889-4325. I know a change in my information could affect eligibility to members of the household. So what I like to do is to make sure when you do this, you are taking very good notes. So I'm gonna jot this down just in case I need it. So I just put in Marketplace call center. And I just like to write it down. Say I need to get back in touch later, I have a number to call. And again, you have to call technically if you have any updates or changes in your income, what have you, in your household, etc. So, and this is for healthcare.gov. So I put that in my notes so I'll always have it. So I agree to this statement. Save and continue. And you're going to sign and submit. I'm signing this application under penalty of perjury, which means I've provided true answers to all of the questions to the best of my knowledge. I know I may be subject to penalties under federal law if I intentionally provide false information. I agree to this statement. And it'll have your full name if you put in your middle name. So my full name, type your full name below to sign electronically. Sign and submit. It's submitting. Boom. Your application was received and has been processed. Eligibility results. Results based on your application that I submitted today, February 15th, 2021. And again, today is the first day that they open up the marketplace again. So I'm going to say this again. If you need health insurance, go to healthcare.gov. Information will be in the description box below. And please take the time and sign up. All right. Giovanni B. Ireland may be eligible for Medicaid. You'll get a final decision from your state Medicaid agency. Required action. View your eligibility notice. Your eligibility notice explains your options for coverage, costs, deadlines, and next steps. If you're eligible for coverage through a marketplace plan, you can enroll after you view your notice. Everyone on your application is eligible for coverage through Medicaid or the Children's Health Insurance Program. So like I'm gonna sign my roommate up next. I'm gonna sign up other people, and this is why I'm making this video. I literally just went through the steps. Literally boom, boom, boom. If you need assistance or you have questions, leave them in the comment box below. I will try to respond and try to get this information out here because I do want to help other people. Now, so would you like to, and they also ask you, would you like to register to vote? Optional. It's optional. You don't have to, but they ask you, click here to register to vote. That's dope that they have all that there, in my personal opinion. Okay, so I'm gonna read some more. It also goes down you can also view the eligibility notice. So just to put it out there, I'm eligible. I may be eligible anyways for Medicaid. You'll get a final decision from your state's Medicaid agency. So they'll be contacting me, which I used email and text messages to be notified. So I've already did that. And I think that is so cool. So learn more about how to appeal. You can appeal your marketability eligibility as well, but I'm going to read this as well so people can have this information. What should I do if I think my eligibility results are wrong? If you don't agree with what you qualify for, you may be able to file an appeal. You can appeal eligibility to buy marketplace plans and also for enrollment periods. If you're applying for help paying for coverage, you may also have the right to appeal eligibility for tax credits, cost sharing reductions, Medicaid eligibility, and CHIP eligibility, which is the Children's Health Care Insurance Program. If you qualify for tax credits or cost sharing reductions, you can appeal the amount you're eligible for. Review your eligibility notice to find appeals instructions for each person in your household, including the number of days you have to file an appeal. Here's important information to consider when filing an appeal. You can have someone file or participate in your appeal. That person can be a friend, relative, lawyer, or another person. Or you can file and participate in your own appeal on your own. If you file an appeal, you may be able to keep your eligibility for coverage while your appeal is pending. Depending on your state and your eligibility results, you may be able to file an appeal through the marketplace, or you may have to file an appeal with your state Medicaid or CHIP agency. Learn more about how to appeal your marketplace eligibility results. You can also mail an appeal request form or your own letter filing an appeal to Health Insurance Marketplace, which is 465 Industrial Boulevard in London, Kentucky. Okay, but all this information is on the website once you fill out the information. Link to this website and the healthcare coverage through the marketplace will be in the description box below. But yeah, and you can learn more about your eligibility rights and next steps. Should I have my information sent to the state Medicaid? You may be asked if any of the people on your application want us to send your information so they can check. So that's stuff right there. Programs and savings may be eligible for. More information for people with special healthcare needs. All of that is on here. So again, and then they send you the PDF copy. You can download the PDF copy so you can see what your health insurance marketplace eligibility is. And I already have an application ID. My application date is already on here. So this is pretty good. You'll get a final decision from the state of Michigan. So those are the next steps for me. So right now I'm just waiting for, you know, whenever I get information from the state of Michigan, and then from there we'll move forward. But I just wanted to sign up for it, walk the steps, talk about it, and information will be in the description box below. Again, if you have any questions or concerns, leave your questions and concerns in the comics, and I will definitely try to get back to you. And may everybody get healthcare coverage and insurance, because everybody deserves it. It's, quite frankly, we should have universal healthcare by now. It's 2021. There's no excuse anymore for people not being, for us as a country not to be able to offer everyone healthcare coverage. Okay, but anyways, I'm out. Deuces.